So it is now time in our agenda for our Chief Executive Officer's report. The Chair would invite you to give a very warm welcome to our Chief Executive Officer, Dr. Marla Weston.
Thank you. Well,
we are pleased to have Marla on board. As many of you know, prior to coming to ANA as the CEO, Marla was the Executive Director for the Arizona Nurses Association. So she truly has her finger on the pulse of what's going on in this organization and nursing. Excuse me. She's already making a positive impact here and has made some terrific changes. I have truly enjoyed working with her. She's an invaluable asset to the ANA enterprise, and we are grateful for her leadership and commitment to moving the organization forward. Again, please join me in welcoming Marla.
Oh, thank you. Thank you, Madam Chair. Thank you for the warm welcome. I am very excited and have very much been looking forward to standing before you here today, not at my first house, but at my first house as your CEO. And I have been looking forward to being with the more than 600 of us joined in this room together today. Delegates, our past presidents, our organizational affiliates, our many guests. It's an honor to be here. And as you can imagine, the ANA staff has been working long and hard to prepare for this event. We were really gearing up in the middle of winter. And I will share with you that here in Washington, D.C., we had a particularly interesting winter. And I have to say that in the middle of what we fondly term Snowmageddon, we actually thought that maybe spring would never come. But as I was preparing for the House and thinking about this, I recognized that seeds that we sow, no matter how tough the winter, always blossom in the spring and summer. And I hope that you have been struck by, as you have been listening over the last couple of days, how seeds that have been sown by previous houses, by previous past presidents, by our previous board of directors, have really blossomed into the work that we have today. And clearly, when I think about this, one of the things that I started reflecting on was really early visionary leaders, people like yourself who actually even came up with the idea of having a nurses association. And it was actually 20 nurses who joined together in a meeting in New York City who formed at a convention what is now the American Nurses Association. So you know, and you heard that my first staff position at ANA was at the Executive Director of the Arizona Nurses Association. I want to share with you that my second day on the job at the Arizona Nurses Association, I was getting oriented to our space. You know, here's the Xerox machine, here's where we keep the paper clips, here's our archives. And we started looking through our archives, and I ran across the meeting minutes from the very first meeting of nurses at the Arizona Nurses Association. It was actually a group of 37 nurses who rode by horseback to meet in Tucson, Arizona, to form what was now the Arizona Nurses Association. And like in many of your CMAs, the first thing that they focused on was introducing legislation to register nurses. Really a strategy to protect their practice and ensure that qualified individuals were delivering quality care to patients, work we are continuing today. So here's what happened. They got a legislator to introduce legislation to register nurses. Year one, it didn't pass. But they were not swayed. They actually got someone to introduce their legislation in year two. Things were not proceeding well. And on the very last day of the legislative session, they rode by horseback to the Capitol, and they sat in the balcony, and they sent word down to their legislators that they were armed with peanuts and popcorn and jelly beans, and they were not going to leave until their bill was heard. And so they describe in a book of how they sat there in the balcony and they saw the legislators periodically looking up. The nurses were still there. And at 2 a.m., their bill was passed. Now, I share that story of one CMA, but you know that it was a story that was repeated in every state and territory represented here. Our voice today is powerful because of those seeds that were planted early on by nurse leaders. Seeds for nurses advocating together were planted then and flourish now. And we've talked a bit over the last couple of days about one of the big seeds that has finally blossomed with our healthcare reform legislation. You know, today, ANA is really this vibrant global enterprise, not only doing healthcare reform legislation, but a full spectrum of work all across our practice area. But I do want to talk a little bit about healthcare reform because it has been on the forefront. I'm not going to spend a lot of time because you've heard a lot about it, but I want to provide you with a little bit of context around a seed that was planted that has blossomed into this work. It was actually at the 1958 House of Delegates that nurse leaders just like you actually declared that healthcare is a basic human right of all people. So here we are 50 years from that, still working on making this vision a reality. But I want you to understand how the seeds that you plant today really carry us forward in the work that we do in the future. Now, as you probably have also gathered over the last couple of days, we are in a very unique time and a position of power and influence. You know, our president, Becky Patton, has established really this unprecedented relationship with the White House and with congressional leaders. But I do also want to share with you that, you know, sometimes it looks like it's all pomp and circumstance. We're having a lot of fun, we're having photo ops, it's really nice. Are we getting any real work done? And it is this access that actually provides the venue for us to have some very powerful conversations. So you saw at our opening session the president leave the stage to get prepared to meet President Obama. This is confusing with all these presidents around here. So our president, Becky Patton, left the stage to go meet President Obama. Now, when you do have these photo opportunities, you have about 12 seconds with the President of the United States. So Becky greets the president. He gives her a very warm welcome. We've been doing work together, and he says to her, "I hope you're happy that healthcare reform has passed." And she says, "Yes, I am, Mr. President, but now we've got to really get to work." And then in the next 11 seconds, she details out the plan of action. So it is that work that you all enable. It is every member that contributes to those conversations happening. But it is more than that. It is the conversations that you all have with your legislators, with your neighbors, in your communities. It is building a conversation that all allows that 12 seconds to occur. And so I want you to recognize that the real work of this association is through the power of our membership and all that you do and all that you contribute. It's part of why we call it grassroots. So the other thing that I also want to share with you that we've not talked about related to healthcare reform is the work that is going to be occurring around pay for quality and quality initiatives. Because in this country, we are very clear that we are not interested anymore in paying for procedures. We want to pay for things that make a difference in patient outcomes. And so the whole genesis is going to be around really understanding what work we do as healthcare providers and how that matters in outcomes that our patients receive. We don't talk about this part of the bill a lot because it's not controversial. And we don't talk about this part of the bill a lot because everyone is moving in the same direction. But it is important for you to understand how well-positioned ANA is because of work that we have been doing for 2 decades to be prepared for this moment in time. So one example of that is actually a decision that was made at the 2006 House of Delegates, in which delegates passed a resolution calling on ANA to consider policy issues around pay for quality. And you are going to hear in a forum later on today the results of that work. So we have a whole framework now, a set of principles around pay for quality that you will hear about how they relate to you in your practice setting wherever you are. The infrastructure is set. We also have been very actively engaged in key decision-making tables around setting up the quality infrastructure. Now, to date, that has all been voluntary. But in this legislation, it shifts to being legislated. And because we have been sitting at those tables, because we are in a position of power and influence, as this moves from voluntary to legislated, we are there because of work that has been done to date for us to be there. The other thing that has been a critical seed that has been planted is the work that has been done around NDNQI. And so it was in the 1990s that the ANA Board of Directors partnered with some CMAs to do some early research to understand how to measure nursing-sensitive quality indicators. These are things that nurses do that actually matter and make a difference in patient outcomes. And we did not know how to measure that 2 decades ago. We started, we piloted, we studied, and we now have measures that are endorsed by the National Quality Forum as measures of nursing-sensitive practice. And so as we move into this world of paying for quality, we actually have a way of showing that nurses matter in producing quality. That's our NDNQI database. And today, over 1,600 hospitals actually participate in this database. That is 1 out of every 4 hospitals in the United States. It's unbelievable. It's unbelievable. So more than just improving care in those hospitals, though, I want you to really recognize what you have done and the power of this database, because we now have this resource of data from 25% of the hospitals in the United States that we can actually do research with. And just this last year, we set up an infrastructure for researchers to access that database and even help us to further understand how nursing practice relates to patient outcomes. So you'll continue to see a lot of work in this area. But it's one thing to measure data. It is another thing to use that data to actually make a difference in our practice. And so we're going to be focusing a lot over the next decade around really understanding how to use data to make a difference. One of the ways we do that is through our NDNQI conference. Here's something that I have to tell you. Abstracts for the NDNQI conference were closed last week. We have 531 abstracts that were submitted.